Good morning, my name is Joyce, and this is my formal critique for IV meds. I have my pre-mixed cefazolin bag, and I have my main line already up and running. I will refer to my drug monograph later on, but first I'm going to talk about cefazolin. Cefazolin is an anti-infective and an antibiotic used to treat bacterial infections. The onset for IV is rapid. The peak is 5 minutes, and the duration is 6 to 12 hours. Common side effects of cefazolin include diarrhea, nausea, vomiting, and cramps as well. I'll provide my health teaching at my patient's bedside. At this point, I'm going to review the medication policy. I'm going to look at 2 relevant points related to administering of IV meds. Next, I'm going to open my patient's chart and I'm going to sign the signature sheet right away. Okay. After I do that, I'm going to go over to my patient's profile. My patient is Mr. Sid Garland. He's being admitted to the hospital for a below-the-knee amputation of his left leg. He's 2 days post-op and tolerated the surgery well, but he's currently experiencing complications due to infections. His medical history includes type 2 diabetes, coronary artery disease, and he has a history of asthma. I'm going to go over his lab results, including his white blood cell count. And I do see that his medications include enalaprilat, which is given 1.25 milligram. It's given by IV for every 6 hours. So next up, I'm going to go over my patient's, the doctor's order for my patient, comparing the doctor's order with the MAR. So I have Mr. Sid Garland. Mr. Sid Garland, his MRI number is 344316, 344316. His date of birth is 11/08/1965, 11/08/1965. He has allergies of penicillin and codeine. The medication is cefazolin. The dose is 500 milligrams. The route is by IV. The frequency is every 8 hours. So the times are 0600, 1400, and 2200. I'm going to be giving the 1400 medication, and special instructions include to give the medication for 7 days. So, and the notes on for the IV order for the main line is normal saline, which is infusing at the rate of 125 ml per hour. So next, I'm going to go over the IV monograph for cefazolin. IV monograph for cefazolin infusion time is 10 to 60 minutes. I'm going to use my nursing judgment, and I'm going to be infusing for 25 minutes because this is the second day the patient is on cefazolin and he has tolerated the medication well so far. The rate is not too fast and it's not too slow. The volume of diluent of cefazolin is 50 ml to 100 ml. Our bag is 50 ml, which is okay. So next, I'm going to go to the IV monographs for compatibilities. On the white sides, med to med, patient is currently on enalaprine, which is compatible with cefazolin, and that's okay. So IV medication with diluent. The diluent is normal saline. It's compatible with cefazolin. And the mainline IV solution is normal saline, and that's compatible with cefazolin. So all the compatibilities are okay. So next, I'm going to go to assess the main line. So I'm looking at the solution's name. It's normal saline 0.9%. The expiry date on the bag is January 2021, and it's infusing at the rate of 125 ml per hour. I'm looking at the tubing as well to maintain checking for patency, no kinks, no air bubbles as well. So now I'm going to go over to the patient's IV site. And I'm checking for any infiltrations, any phlebitis, any inflammation, edema, or leaks. None of that at all. And when I touch, it doesn't feel hot or cold to touch at all. So it's okay. Critical thinking, I've already assessed my patient's pain skill levels. And I've already assessed his vital signs as well too, which is within normal baseline range for the patient. So I'm going to come back to the med room. I'm going to perform hand hygiene. And I'm going to check my premixed cefazolin bag. I'm checking for clarity and for leaks. The bag is okay. So the expiry date on the label is December 2020, and the expiry date on the bag itself is November 2020, and that's okay. So now we're gonna go to the first check. Comparing the bag with the MAR. So I have Mr. Sigallon, Mr. Sigallon. Medication is cefazolin. The dose is 500 milligrams. The route is IV. The frequency is every 8 hours. I'm giving the 1400 medication. The site is going to be at the patient's right arm, and the reason is for post-op surgery. Right away, I'm going to do my second check. Mr. Sigallon. Medication is cefazolin. The dose is 500 milligrams. The route is IV. The frequency is every 8 hours. I'm giving the 1400 medication. The site is going to be at the patient's right arm, and the reason is for post-op infection. So after my second check, I'm going to do my calculation. And first of all, I'm going to calculate by gravity. And that's giving 20 GTT per minute. And next, I'm going to calculate by pump. And that's giving me 120 mils per hour. So after that, I'm going to do my third check. So I have Mr. Sigallon. Medication is cefazolin. The dose is 500 milligrams. The route is by IV. The frequency is every 8 hours. I'm given the 1400 medication, 1400. The site is going to be at the patient's right arm, and the reason is for post-op infection. So I'm going to flip my worksheet over again and do my second calculation. First of all, by gravity. And that's giving me 20 GTT per minute. And the next calculation is by pump. And that's 120 mil per hour. So at this point, I'm going to call my tester over to come review my calculations. And once that's done, we're going to start to prepare the med. Okay, so I'm going to open the secondary medication line. Okay, and I'm going to close the roller clamp right away. Okay, maintaining sterile asepsis, I'm going to spike my mini bag. Okay, once that's done, I'm going to gather my supplies with my alcohol swab. And before I do that, I'm going to perform hand hygiene. I'll take my supplies and my worksheet to my patient's room. Hi, my name is Joyce. I'm a nursing student from Durham College. I'm here to administer your medication. Is that okay with you? Patient is going to give me his consent, and I'm going to do a quick environmental check to make sure that everywhere is free of clutter and safe for the patient. Okay, and can I get you to confirm your first and last name? I'm going to be comparing the patient's last name with my worksheet. Is going to give me his answer. Can I get you to give me your date of birth? And I'm going to ask the patient if he has any allergies. He's going to provide a response. And I'm going to ask him what is his history of reactions to his allergies. He's going to let me know as well too. So after that's done, I'm going to now set up my IV. So I'm going to hang up my mini bag. Okay, and I'm going to close the clamp right away on my main line. And once that's done, I'm going to get my alcohol swab, and I'm going to clean my port vigorously and thoroughly. And once that's done, maintaining sterile asepsis, I'm going to attach my mini bag to my main line. Okay, after that's attached, I'm going to bring down my mini bag, and I'm going to open the clamp to make sure that the drip chamber is filled halfway. And once that's done, I'm going to close the clamp again, hang up the bag, and now I'm going to drop my mainline bag on the hanger so that my mini bag solution drops by gravity first. So once I've dropped the main bag, I'm going to open the mini bag clamp completely open. I'm going to open it up, and now I'm going to regulate the drops per minute, looking at the drip chamber on the mini bag, ensuring that I get 20 GTT per minute. Okay, and once that's done, I'm going to go back to my patient, and I'll give him a health teaching. So I've just administered cefazolin. It may cause diarrhea, it may cause cramps, and it may give you a loss of appetite. If you do experience any of the symptoms or side effects, I'm going to put the call bell within reach, let one of your nurses know, and we'll be happy to help you out. Okay, and I'll advise patient I'll be back within 15 minutes to let him know, to find out how he's doing and how he's tolerating the medication. I'll leave patient safe and comfortable, perform hand hygiene, and I'm going to go back to the med room. I'm going to document on the MAR. I'm going to sign next to the 1400 medication time, and the site is the patient's right arm. And once I do that, I'm going to call my tester over to review my documentation and make sure everything is complete. And that's the end of my critique.